Advantan is a glucocorticoid, anti-allergic, anti-inflammatory agent. The active ingredient in Advantan, methylprednisolone aceponate, is a non-halogenated steroid. When applied externally, Advantan suppresses inflammatory and allergic skin reactions, as well as reactions associated with increased proliferation, which leads to a decrease in objective symptoms of inflammation. Indications: skin diseases, including chronic course. Amenable to DC therapy for external use in adults and children aged 4 months and older. Atopic dermatitis, neurodermatitis, true eczema, contact dermatitis, allergic dermatitis, dyshydrotic eczema, microbial eczema, degenerative eczema. How to use: outwardly. For adults and children from 4 months, the drug is applied 1 time per day with a thin layer of the affected skin. Continuous daily use of Advantan in the form of a cream is for adults no more than 12 weeks, for children no more than 4 weeks. Advantan cream is a dosage form with a low fat content and a high water content. Therefore, it is recommended for the treatment of acute inflammatory processes and the weeping stage of eczema in very oily skin, as well as in the localization of the process both on smooth skin and on the scalp. If the skin is excessively dry with prolonged use of the cream, it is necessary to switch to the dosage form of Advantan. Contraindications: hypersensitivity to the components of the drug, tuberculous or syphilitic processes in the area of application of the drug, viral diseases, for example chickenpox, hyperzoster in the area of application of the drug, rosacea, perioral dermatitis in the area of application of the drug, skin reactions to vaccination in the area of application of the drug, children age up to 4 months. Special instructions: in the presence of bacterial dermatosis and/or dermatomycosis and addition to the therapy with Advantan, it is necessary to carry out specific antibacterial or antifungal treatment. Avoid getting the drug in the eyes, as with systemic corticosteroids, glaucoma may develop with topical corticosteroids. Side effects: usually the drug is well tolerated. Very rarely local reactions such as itching, burning, erythema, and the formation of a vesicular rash can be observed. If the drug is used for more than 4 weeks and/or on an area of 10% or more of the body surface, the following reactions may occur: skin atrophy, telangiectasia, striae, acneiform skin changes, systemic effects due to absorption of the corticosteroid. In clinical studies, none of the above side effects were noted with the use of Advantan up to 12 weeks in adults and up to 4 weeks in children. In rare cases, folliculitis, hypertrichosis, perioral dermatitis, skin depigmentation, allergic reactions to one of the components of the drug may occur.